All right, here is your question. Okay, so if you have read and understood, considering a clinical examination station, kindly please begin.
Hello.
Yes.
Okay. Hello, I am Dr. Ali, one of the surgical team. May I confirm your name and age?
Yes, I'm Tom, 55 years old.
Nice to meet you, Mr. Tom. Today I've been asked to examine your chest. Is it including looking, feeling, and also listening to your chest, tapping on some points, and also looking to some general points. Is it okay with you?
Yes.
Do you have any pain before I start?
Yes.
Where you can exactly where is the pain?
Yes, I've
Oh, I
chest
am
pain
sorry.
and I'm having difficulty breathing.
Oh, I am sorry. I can see that you're feeling dreadful. So for that, I will start firstly to check from your head to your toe, and also check first your vitals to ensure everything is going well. And through that, I will explain every step while I'm going along. It's okay with you?
Yes.
Okay. Could you start first to put this non-rebreather mask?
Do what, please?
Okay. I need you to put this oxygen mask.
Okay, you do it. You do what you have to do.
Okay, let me do it. It is a non-rebreather mask, and I will put the flow around 12 to 15 liter. So you are feeling better now?
No.
Oh,
Yes,
do you need any painkiller?
No, that's all right.
Okay, will we continue? Now I will attach this small device to your finger. It will tell us the exact your percent of oxygen in your blood. Okay.
Okay.
Okay. Now I will better lower your lower eyelid. Is it okay with you?
Yes.
Okay, thank you. Now I'll check your windpipe. It may be slightly uncomfortable. Sorry for that. I will be gentle.
Okay.
Okay. I am looking to your neck. There is no increasing neck veins, and also I will feel the pulse in your neck. Okay. Okay. Now I will look to your chest. I need to know the respiratory rate from the chart. Okay. Now
okay, continue. You're doing the examination.
Yes.
What more would you do?
I will order some steps from the nurse.
Okay.
And I am going for that.
For airway, you've already assessed that since patient is talking, so you have assumed that airway is intact, it's not blocked or anything. Then you have moved to breathing. You look for the signs of cyanosis in the mouth and nail beds and lips and etc. Then you check the trachea. Then you will go for the chest movements. Have you checked that? Have you done that?
Oh, okay. Yes. I will check that.
Yes.
Okay. Okay. Now I need you to stretch your arms.
Sorry, please. Can you, because I can't see, so you'll be doing it on, you'll be examining the patient in real life. So where exactly would you put your hands, or one hand or both hand? How would you examine? How would you make sure patient's chest is
Yes, I should talk about that. Yes.
Yes. So can you please
Okay.
explain?
Okay, I will explaining this more. Okay.
Yes. Yes. Then you'll do
Now
for the percussion.
now
You'll go for percussion.
first I will go for chest expansion after respiratory
Yes.
respiratory rate and examine for the central sinus and peripheral sinuses,
Yes.
and also any clubbing in the patient hands. After that, when I go for chest
Percussion.
expansion, I will put
Yes.
both my
Yes.
expansion when I put my both hands and at the three level, supraclavicular and at umbilical level, sorry, at the nipple level, and after below the nipple level, and
Yes.
after that go for percussion. I will warn the patient first that I will tapping on your some points of your chest. It may be
Yes.
slightly discomfortable. If you have any pain, just stop me.
Yes.
Supraclavicular, indirect, and direct on the clavicular, and space by space. Comparison anterior with anterior and lateral with and lateral contralateral side.
Yes.
Till downward. After that, I should tell the patient I will listen to your chest in three
Okay.
different points.
In this one, how would you examine the chest? In case of if patient is having chest pain, only you'll examine it from the back.
I will offer him that I now after auscultation I need to examine you from back. Do you have any problem with that, or this is can you tolerate that or not?
Okay. Yes.
Okay. After auscultation to the
Then
whole
you move
areas
on
of
the circulation. Yes. You will make sure if
yes.
patient is yes.
Before that, I will ask for ABG and order chest X-ray,
Yes.
and that we can auscultate the heart
Yes. Yes.
while I'm using the stethoscope.
Yes.
Auscultate the four areas.
And
It's
neck
mainly
veins,
cardiovascular.
you've already mentioned neck veins, and you'll check for the eyes for the pallor. Then
Yes.
disability.
Then I know I need to count the pulse and
Yes.
the equality and the regularity and any radial delay or carotid delay. After that, for blood pressure, check the blood pressure.
Yes.
And ask the nurse to put this cannula, or it's called elastic tube, in the vein of the patient, and offering to give the patient fluid resuscitation as a
Okay.
state. After
And
that,
then yes.
also attach the patient with urinary catheter or this tube to your external genitalia.
Yes. Okay.
To monitor.
What would you do
that.
last? You'll examine the legs for the DVT, and you'll even squeeze the calf muscles to see or rule out tenderness.
Yes.
After
C, we have
yes, you'll because the
again
patient is
we'll
post-op.
check.
You'll ask for to see if the wound dressing is soaked or not, or if you'll even ask to remove the
it's
wound
with exposure.
dressing.
Yes.
But examiner will say consider, and then you will stop. Okay.
Yes.
So,
to point with the disability of the patient, I will ask the patient again to confirm that the patient is alert with me, and also ask for
can you
random blood
please
glucose.
summarize your
and
examination
we can
now?
check the
Yes,
reflex.
please summarize the examination now.
Okay, today I have examined this gentleman called Mr. John. He is 55 year old.
Yes.
The patient underwent post right hip replacement today 8 days ago. For that, the patient looks dyspneic and in chest pain. We start the Ccrisp protocol. The airway, we start to put oxygen on a respiratory mask at the 15 milliliters. The patient feel better after that. And for breathing, we did the respiratory count was 25, and we see that the patient is tachypneic, and the patient show some dyspnea and some cyanosis. And the bioauscultation, the patient had bilateral equal entry, and chest expansion is equal bilateral. Yes. So the circulation, we measured the patient blood pressure. It was slightly on the hypotensive side. So start
what are
fluid
your
challenge.
What are your provisional and differential diagnosis?
Regarding the base complaint of the patient and his history of operative pain, operative data, he maybe have pulmonary embolism.
Okay, and differential diagnosis would be MI, mitochondrial infarction, or
it be
pneumonia,
myocardial infarction or
pneumothorax, unlikely, but
pneumothorax
okay.
or
How would
sepsis
you
after.
please confirm your how would you confirm your diagnosis? What investigations would you ask for?
The gold standard investigations, CT, pulmonary angio, and also we should withdraw some labs, full blood count, and do D-dimer and fibrin degradation factors products.
Yes. What would you
and
see
doing
in
simple
ECG?
chest X-ray and ECG.
Yes. What would you see in the ECG to confirm your diagnosis, please?
First, the patient has sinus tachycardia and increase S wave for lead 1 and the T wave and Q wave and
T wave
increase in
inversion.
the
Yes.
lead 3.
Yes. Okay.
Yes.
Right. Can you please tell me if you, because you're suspecting it to be pulmonary embolism, how would you manage the patient?
First, if the patient is stable, we can give him heparin or unfluorescent heparin, induction dose around 70 or 80 international unit per kg, and maintenance dose around 15 mg per kg every 4 hours, and monitor this with activated partial thromboplastin time. If the patient is unstable, we should prepare him for thrombolysis or embolectomy.
Okay, just suppose you're in operation theater and you're scrubbed, and a nurse comes and tells you about this patient. What would you do?
While I am in the theater.
And scrubbed, yes, please.
And the patient is a ward, right?
This patient. 55, and this same scenario, that patient is having sudden onset of chest pain and difficulty of breathing, and it's 8th post of day. Nurse comes and tells you the same thing. You're scrubbed. What would you do?
I think I need to go to see the patient immediately.
No, you'll call the crash call. You are scrubbed. You will not leave the patient. You will not go, but you will call the crash call. So it will be an emergency. Code blue. Someone else will come and take care.
Okay.
Good. Here, one thing you have to imagine what I've got the feedback that the patient is just dull, lying down, not responding, not talking. And once you ask the patient, they will not, and this is inpatient, so you will not ask for the name and age to confirm. You will confirm the name and age of the patient by looking at the armband, right? In the beginning, patient will be just lying idle, may not respond to you, may not even give you any responses, will be just lying down, and you will just see that the mask will be there, but mask will not be attached with the oxygen. Okay, so you'll make sure that you'll attach the mask with the oxygen. You'll make sure it's attached and it's flowing. Secondly, if patient is not answering you or not responding, then you'll make sure you ask the patient, can you open your mouth? Can you do ah for me? So in that way, you'll say, okay, I'm looking for the sinuses and for the dehydration of the mouth. And at the same time, since patient is obeying, so and obeying and doing ah, so you know then there is no obstruction, airway obstruction. Or maybe if you ask the patient to pull the tongue out, so patient maybe does the ah and brings the tongue out, so you know patient is obeying. But if it's because it's in this kind of situation, so they'll try to make it or act as if it's really pulmonary embolism, so may not talk so much. Okay, so that part of the examination was little. And then you'll do the inspection. Okay, all the inspection, but since patient would not be talking, so you'll convert your respiratory examination into Ccrisp protocol right away. You'll tell the examiner that, okay, patient in severe pain, patient can hardly talk and patient is having chest pain. So I'll convert my respiratory system examination into Ccrisp protocol and we'll convert it. Good.
Okay.
Thanks.